Now see the other important pancreatic neuroendocrine tumor. One of the pancreatic neuroendocrine tumor is neurotensinoma. And this neurotensinoma, it causes hypokalemia, weight loss, hypotension. These patients are having cyanosis, flushing and diabetes. And most of the patients who are having neurotensinoma, these are usually malignant. Neurotensinomas are usually malignant. Next is GRFoma. What is the full form of GRF? It's the growth hormone releasing factor. This is growth hormone releasing factor. So obviously in GRFoma, there is excessive secretion of growth hormone releasing factor, and because of increased secretion, obviously there will be increased secretion of growth hormone, means these patients are going to develop acromegaly. What is the most common site of GRFoma? It's not the pancreas, it's lungs. The most common site, it's lungs. Where exactly? In the bronchus. It's the bronchus. What are the other sites of GRFoma? Other sites are pancreas, jejunum, adrenal gland and retroperitoneum. These tumors are usually large at the time of presentation. How much is the size? Size is more than 60 centimeter. And 50% patients, they have Zollinger-Ellison syndrome. And approximately 33% patients have MEN1. 33% patients have MEN1. So usually these tumors are larger at the time of presentation. Because of excessive production of this growth hormone releasing factor, there is increased growth hormone, and because of this, what will be the symptom? Obviously, patient is going to develop acromegaly. So these patients are having acromegaly, and where is the tumor? Obviously, most common site is bronchus, but we are talking about pancreatic neuroendocrine tumor, so patient might be having what? Pancreatic mass. So patient presents with acromegaly and pancreatic mass. In 1/3 of the patients, there is metastasis at the time of presentation. So approximately in 1/3 of patients, there is metastasis at the time of presentation in GRFoma. Next is PPoma, pancreatic polypeptidoma, and these are large, these are solitary. And what is the most common site of PPoma? The most common site of PPoma is head. The most common site, it's head. Clear? 80% of PPomas at the time of presentation, they are malignant and metastasis. So in 80% cases, it is malignant and metastatic at the time of presentation. Malignant and metastatic. Now imagine if the tumor is resectable and the location is head of pancreas. Tumor is resectable and the location is head of pancreas. So what should be the treatment? We perform pancreaticoduodenectomy if it's resectable in patients of PPoma.